Hey, good morning, everyone. This is your host, Susan Rosa, and I have a special guest today. This person joining me is Cheryl Borchardt. I hope I'm not butchering your last name.
You did a great job.
Okay. And Cheryl is a functional medicine certified health coach and national board certified health and wellness coach. I have to read that so that I get it correctly. She helps individuals calm bothersome symptoms associated with chronic disease and autoimmune, I don't know why I can't talk today, autoimmune conditions by helping them get their lifestyle and gut healthy. And I think that kind of covers everything that we're always talking, or I'm always talking about on this podcast. So that's why she fits right in, and why I invited her to come and spend a little time with us.
Yes, thank you for having me.
Oh, thank you. So I don't know, Cheryl, if you want to tell us a little bit more about the kinds of people that you deal with and the kinds of issues that you see, particularly maybe now coming up in your practice.
Right. Yeah, that's a great question. So I've been a health coach for almost 5 years, and it all started because I had a lot of health issues, more chronic health issues, and I really couldn't get answers from my physicians about why this was happening to me. So I finally ended up seeing an integrative physician, and they are similar to functional medicine, where they look at the root cause and try to help people optimize their lifestyle and maybe do some specialized testing.
Okay.
So I learned a lot during that time. I learned a lot about the way I had been eating and how it was not the best for me. And I was able to change a few things and see some results right away. Had some other things testing and such. And so this, just honestly, the small changes that I made really made a big impact in my life. And I was able to personally reverse all of those health conditions that I had been dealing with. So I had been dealing with chronic migraine headaches, chronic anxiety, chronic hives. I had developed asthma as an adult, so I had all these chronic health conditions that were really tied back into my lifestyle. So that kind of brought me into, I had to do all that on my own, right? I had to learn it all by myself with really no support. So that's kind of how I became a coach and started working with other individuals with chronic health and autoimmune conditions.
Interesting. Yeah. It's funny how so many of us have ended up in this area, one, because of our own issues, and two, because we just haven't been able to find, or we weren't able to find, people who could support us and help us in the way that we wanted to be supported, not just pushing pills at us.
Yes, absolutely. And I think, that's really, for me, what it came down to was every doctor I'd seen, if I did, and I know a lot of people feel this way, if you don't fit inside of the box, then sometimes they don't know what to do with you except to give you something that might calm your symptoms down, right? But really doesn't get to why something's happening.
Yeah, it's kind of a Band-Aid medicine. Even though they think they're curing it just because it's not apparent.
Right.
It always reminds me of that game where the things pop up in different places and you keep pushing them down, they keep popping up somewhere else.
Whack-a-mole, right?
Whack-a-mole, thank you.
Yes.
Yeah. It's because I started out the same, in very much the same way. And for me it was all food. It was the food I was eating, and I was just allergic to it.
Yes, absolutely.
And I was very lucky that I I had found an allergist who we ended up doing a challenge diet, and that's how we figured out, again, like you, it took like 3 days for everything to go away. once I stopped all the things that who
Right.
knew, right? And then, the luckiest thing for me was the allergist that I picked, because he said, okay, I can't do anything else for you. Just stay away from the food.
Mm.
Have a
Yeah,
good
and I
life.
think,
If you have any
right.
other problems, come talk to me. But
Yeah. So you learned taking those foods out helped you.
mhm,
And I think that, a lot of times when I work with someone, we do see that food connection often, especially, and this ties back into gut health,
mm,
is, if we've got a compromised gut barrier in
mhm,
any way, then some of those food, particles, proteins and such, they get into the bloodstream, and then it activates your immune system. So your body's, like, what's going on? These things shouldn't be here. So it starts turning on all of its defenses, and then you start having these symptoms. So yeah, one of the ways I do work with people is, a lot of times helping them find an integrative or functional medicine physician that can really do the testing, the diagnosing, the treating of any underlying things that might be there.
uh-huh,
And so what I do is help them implement, like a gut protocol, like to kind of heal the leaky gut with lifestyle factors. And to, for some time, typically they need to take out foods and work on that gut healing. And then, sometimes, a lot of times, some of the foods that we should be eating, a lot of people can bring back in. It all depends, right? Everybody's
yeah,
individual, so it's not always across the board, this is how it works.
mhm,
But, a lot of times they can bring some things back in. And then, those inflammatory foods, like, and I use these as examples, so probably gluten, dairy, sugar, things like that. Those are the ones we just encourage people to
yeah, those are
mostly
mine.
stay away from, just because they are, constantly,
Mhm.
irritating our gut lining for most people.
Yeah. Oh no, exactly. Exactly. In fact, it's funny side story is that I had I had developed all this after I'd been going out with my now husband for
Mm-hmm.
a couple of years, and he always used to say that if he had met me after I had developed all these things, there's no way that we would still be together. It was
Goodness.
just too difficult dealing with it.
Yeah, it is. They can consume your life, when
Yeah.
you're playing whack-a-mole, right? When you're trying to figure out, is this what it is? Is that what it is? So
Thank
you're
you.
trying these new
Yeah.
things. Maybe you're trying a different way of eating, or, you know, cutting down the toxic chemicals in your house, whatever that is, we try all these different things. So it can really consume your day.
Yeah.
And it can feel, almost like I can't think about anything else. This is, where I need to focus my time and energy.
Yeah.
Yeah.
Yeah. I am amazed though how much the world has changed, and it's not
Mm,
some of it's for the good, and some of it reflects the fact that we actually haven't been getting better
mm-hmm,
world-wise. Is that when I got all of this, which was back in the 80s,
mm-hmm.
um, you know, staying away from bread and dairy, asking people at a restaurant what was in the food. I mean,
Right.
they were not happy with me
And they look
at
at you
all.
like you
Yeah,
have two heads.
yeah, exactly.
They don't hear
Now I
that very
say,
often back
yeah,
then.
and
Yeah.
now I say, oh, I have an allergy to it. Oh, okay, yeah, yeah. Well, this and this and this. Now everybody's so educated about it all,
Right. Yeah.
which is good, but at the same time, it's so reflective of how much our society has become used to bad food and
Mm,
people having reactions to them.
right. Yeah.
But there's
And
also
I
a
think,
lot, there's also a lot of organic food out there now, which I will say is a good thing.
right. Yeah, it is.
Yeah.
And I think, yeah, we have so many more choices now. We
Mm.
have so many more, like, even things that aren't in season. Yeah. So one of our favorite things is, you can get organic things that are frozen sometimes, and,
Yeah.
use those if it's out of season. Yeah, I think a lot of this is really coming out now, just when you mass produce and mass grow food, um, you lose a lot in the process, right? You lose a lot of nutrition. If you're eating, of course, something that's from a factory, then you're, kind of causing that inflammatory process to kind of stay permanent in your body. So one of my favorite places to start with somebody, if they're ready, is looking at what you're eating, just saying, what are you eating? Where are you ready to make some improvements? Or what do you think would be helpful for you? And, if they have a physician and they're working with, their physician, that's always wonderful. If not, I don't prescribe a meal plan. I just help them to kind of, decide what's going to be best for them to kind of move into, and of course I educate along the way, give them options, and then they can make a decision about what they want to do. But sometimes, their physician can prescribe maybe a short-term eating plan. Maybe it's an elimination diet, or, there's so many out there now, low FODMAP if you're having GI problems, and like Candida, there's so many things that depend on what's going on. So yeah, I think food is just so foundational. We eat so many times a day. It's a great place to start, and a lot of people realize, wow, I didn't realize these things were, causing inflammation or compromising my gut, so.
Okay. Yeah. It is, even in this day and age, those of us that are interested in it, right? We'll stay up with all of these things. Excuse me. But you forget there are still a lot of people out there who, the only medical advice they get is in, the magazines that they read, or things they see on TV.
Right. Those cereal commercials, the all the fun commercials for kids, yeah, that's right. They may not really get outside of that marketing, what's really there.
Yeah. And they don't put together, oh, I ate something and now I don't feel well.
Yeah.
They don't make that connection.
That's right. That's a good point too. I like to talk around this a little bit. Sometimes if you have a food allergy, a true food allergy, that's something that, you would have a pretty immediate reaction to. And typically you already know this unless you develop it later in life. So those are, true food allergies. Now, a lot of people do have food sensitivities, right? And so they may have a delayed response. Sometimes it can be a couple of days before they realize that milk they drank Monday is causing them to, have a migraine, or that was the case for me. That's my example. Yeah, so they may not make that connection back. And I've had clients who are doing food journals, and they're like, well, I don't eat that much dairy, or I don't eat that much gluten, but any little bit, right? If it's affecting and triggering your immune system, is gonna probably give you symptoms. So yeah, I think even if you I feel like a lot of times elimination diet, because it lets everything calm down.
Yeah.
If someone tries that and they get some of those inflammatory things and bothersome things out, and a lot of times they'll see their symptoms just really calm down a lot because their immune system's not being triggered as often.
Yeah, no, and that's exactly what I had.
Yeah, me too. That was, and there's a lot of testing that can be done to look at food sensitivities. But really the gold standard in the functional medicine arena is the elimination diet for that. So I think it's free. It's free. You don't have to pay for the test, but yeah, you have to make some different choices.
Yeah. And you have to be, what's the right word? I can't think of it, but in other words, you really need to feel bad before you can really do an elimination diet well, I think. Right?
Yeah, I agree. And you have to be ready. You have to be ready to do it and be committed to it. And so that's not always where somebody wants to start, but sometimes it does get to that.
Yeah, and especially if they've got a family, then that can be difficult. as well, because then they're having to make them their own meals, and the meals are, you know, but that's you know, there's just so many things that come into it.
Yeah, another thing too is cultural influence. You know, a lot of people have that, and there are certain foods that are just part of who they are. They've grown up eating these foods with their family, and so those are important. And so you know, working with people through these challenges is important, and to be able to, you know, maybe honor the foods that are culturally important for them as well. And you know, when you're told as a person, oh, you've got to cut that food out, you know, something they've always had, it's hard.
Pizza.
Yeah. Right. And thankfully we can usually be pretty creative and come up with something that will satisfy that desire to have something like that, that's not going to compromise what they're trying to do with their health.
Yeah. No, I totally agree. Yeah, it's yeah, but you know, but you're motivated. If you really feel badly, then all of a sudden it's not as big a deal. I think it can be a big deal for the people around you, but it's not as big for you if you really get that first thing of, oh, I feel so much better.
That's right. And a lot of times that is what helps somebody to move forward and continue being a detective and trying to, you know, pinpoint what's going on. Is if you take the elimination diet, you take that and try it, and you feel better, then you realize how much better you can feel, right?
Yeah.
And I think that's important, is you have a little win, right? You're able to kind of feel motivated to try some other things.
Yeah, absolutely. So what kinds of issues are you seeing now? I mean, has it changed since COVID started? And you know, are you doing things differently? I mean, I don't know how much you did online before COVID started, or
I have been virtual the whole time I've been a coach, so that hasn't changed much for me.
Well, that's
even
good.
with my local clients, I tend to work virtually just because it's easier. Nobody has to drive anywhere to meet up. You know, there's not that time factored in, so I can work with anybody anywhere. And since COVID, you know, I've worked with I've partnered with several physicians' offices, and I work with individuals as well who, you know, need some support. So I've worked a lot in the area of chronic disease and autoimmune disease. And so, you know, I can have somebody who is maybe had rheumatoid arthritis. So I have a lot of clients who've had rheumatoid arthritis, and I've had several who've been able to get off medication.
Wow.
You know, not everybody, and that's not me. I don't help people get off medication. I don't say stop your prescription. That's not what I mean. But the changes they've made have helped so much that they don't need those medications, so they work with their doctor to get off of those. So I tend to see a lot of arthritis, a lot of joint issues. Some people who have, you know, chronic Lyme disease and Epstein-Barr reactivation. And a lot of that too, you know, can be tied back to just having a good, having your immune system working well, right? And supporting it in all the ways that we can. And I've worked a lot with people with obesity, with high blood pressure, heart disease, type 2 diabetes. So these tend to be the bigger things that I would probably see. And when people learn, I'm a type 2 diabetic, and I actually, you know, I don't have to go down this road of I'm going to start with metformin and end up on insulin, and then, you know, I might start having neuropathy, you know, like you kind of expect that it's going to take this path. But I think people are realizing that, and it's, you know, scientifically, people are able to reverse things like that. not everybody, but
Uh-huh.
a lot of people can with
Uh-huh.
the help of their doctor, maybe the help of a coach, and having that collaborative team to support them, because they're going to have to make change, right? They're going to probably have to make some lifestyle change there.
Yeah.
And simple things, but they're not easy things, right? They're required, to feel better. But I think when people can do that, they're saving their, they're preserving their
Mm-hmm.
livelihood. They're preserving their health, and they don't have to go down this road. They don't
Mm-hmm.
want to. So yeah, those are the bigger ones that I work, people I work with,
Uh-huh.
and so we look at the whole lifestyle. We don't just focus on food. That's a big portion of that.
Yeah.
But
Yeah.
we're
Yeah.
looking at sleep. We're looking at,
Mm.
how much water are you drinking every day? Are you chronically stressed, which also is another factor with gut health, right? You're
Mm-hmm. Oh yeah.
compromising your gut there. And I think, you asked with COVID how that's changed, and it's changed in a way that I think people are starting to see, oh my goodness, I have risk factors for having a bad outcome with COVID. I have, maybe I have blood sugar problems that aren't controlled, or, severe obesity or high blood pressure. And there are some
Mm-hmm.
studies out there. I don't have them right here in front of me, but you could probably look around Google. I think it was a study in, I'm trying to remember the country, can't remember right now, but they've studied kind of the, the rate at which somebody's gonna have a bad outcome with some of these. And it's, those are the big ones, is like type 2 diabetics. And
Yeah.
so for somebody to say, I'm going to take my health into my own hands, because really it is in our own hands. No
Yes.
doctor can motivate us. It has
Yeah.
to come from us, right? To want to make a change.
Absolutely.
So, and that's where coaching is really so beautiful, is we're here, kind of walk that road with somebody. Like, I need to change. I want to change, but I don't know how. I don't know what to do. Yeah.
Yeah. Yeah. Yeah. And just to kind of be a cheerleader.
Right.
As
Yeah.
well with
Some
someone.
accountability. Yeah. And just some
Yeah.
guidance. We're never prescribing anything to someone. We're never making it about what we want for them.
Yeah.
We're making it about where they're ready to make a change and helping them to do what they're ready to do.
Yeah. Yeah. And also I think the other part of it is that there's always so many questions that come up. And you can't always be running to your doctor
right
all the time asking, right? Some of the time they don't know, actually.
Right. You're right.
There are things that the coaching people know that have more to do with, as you say, lifestyle and all of those other things, the things that are kind of around the issue. And I think that's another part that's so important, because having somebody that you can ask a stupid question.
Yeah. And yes. Right? Ask anything and feel like they're going to help you find the answer. And that's essentially what I'm, and there are, of course, we know there are no stupid questions, but people do feel like sometimes they can't ask these questions because it's going to, maybe they think, well, this should be obvious to me, but we don't all come from the same place. Yeah. And we didn't all grow up the same way, and we didn't all learn those same things. So education piece.
Right. And I also find that a lot of coaches have come from the point of having issues themselves. And a lot of the time they'll coach around issues that they had, or gone into other very close kinds of areas. And so they can bring a certain experience into the conversation. And that as well can make the I don't want to say patient, but the person who's having the client, feel better. Okay, this person understands. This person's been there.
Right, and to have the empathy to say, hey, I can see how that can feel hard, or I can see how this can feel impossible, and to encourage them that you've got what you need inside of you to do what needs to, what you feel needs to happen, to to heal. And so that, I think people just need to know that you've got all that you need. Sometimes we have to draw it out, but it's there.
Yeah. Because unfortunately, we're not taught that when we're little kids. We can start teaching the new little kids that, but not when any of us grew up. Oh, if
Yes,
only,
that's right.
yeah, how our lives would have been different. But anyways, it is, I was going to say funny, but that's not exactly the right word. But anyways, so tell me a little bit about how you see things being different or different issues in people that are a little older, that are 50, say, or older, or 40s, 50s, when all of our bodies really start to change, right? Women go through menopause somewhere in there typically, and men have their own version. It's not quite as obvious, but it's, I think it's a whole different, I want to say ball of wax, but that's sort of a,
So I think,
I don't know why I came up with that, but yeah.
Right. We're getting to midlife, and we're, evaluating how we feel maybe. So I think, and I work with people I've worked with teenagers all the way up to, 70-ish-year-old people. So I've worked with a lot of different age groups, and I tend to see people who are probably closer to the menopause age or after, and women and men, kind of that, I would say anywhere from 40 to 60. It tends to be kind of I work with people in that age group the most. And what I hear a lot of people is they're exhausted. They don't have the energy. They have pain. They have, joint pain is a big one. Brain fog is another one. So that all of those are probably the top things.
I have the brain fog. Yeah.
Yes. Yes. And, so I think when people, so you get to this point and, you're aging, you feel it, we all know that every day, but when you get to that age, you really do feel things a lot more. And you start to think, okay, this is what it's like. This is what it's going to be like. And it's only going to get worse. So we kind of have this mindset of it's never going to be better.
Yeah.
But I've seen people feel better in these decades of life than they have when they were in their 30s and 20s, because they actually are intentional about their self-care more so in these 40, say 40 to 60 and up age groups. Whereas in your 20s and 30s, you may just think you can get away with those things. And that's probably what got you to where you are, right? Some of it anyway.
I don't even want to think of some of the things I did when I was in my 20s and 30s.
Right. And so I think what is so rewarding for me as a coach is to work with somebody who is in that kind of what we just talked about, those, fatigue, joint pain, brain fog, exhaustion, all that stuff, to know that they can do some things to help themselves feel better. And I will say, in the nearly 5 years I've been coaching, I do a symptom questionnaire with everybody when we start our program, and we repeat that monthly. 100% of my clients have had improvement in their symptoms. And that's not anything I've done. This is them making the changes. So I'm just here to help, and I'm just here to support and guide.
Yeah.
But I think really, we're never too old to think about improving ourselves, whether it's learning something new or, changing something we've always done. And I think that is the most rewarding part of it, is to see. I've had one of my clients, so she was in her mid-60s. She had been very heavy for most all of her life, had started, when she was young, but it had gotten worse as she got older. And so she is in so much pain, and she really loved volunteering and doing things where she could go help make people's lives better. So like some of that involved painting or helping fix people's homes and things like that.
Uh-huh.
And she was getting to the point where she couldn't do it, but it was
Oh.
really meant so much to her to be able to. And so she and I, just kind of came up with a game plan for her. And she, within a couple of weeks, had already started feeling so much better. Like our mitochondria, our cells in our body that provide this energy, and sometimes are, not healthy, but a lot of the lifestyle things can support that. So there's so many things we can do, so many things in coaching. But yeah, I would say in that age group is probably the most rewarding, just because they feel better. They do. And they would have never felt that way had they not tried.
Yeah. No, that makes a lot of sense.
Yeah. And I think a lot of people in that age group are on medication too. And,
Yes.
and sometimes it's needed for a short time. But if you're one of those people, and I'm talking to the audience, if you're one of those people who doesn't want to be on all these medicines that you might be on, then that's where I would encourage someone to find a functional medicine or an integrative physician that can help them look at everything and say, do I really need to be on this or that? And make a plan for that, to see if there's some ways they can come off of it.
And I think the other thing that happens too is that they end up going to multiple doctors because they get sent to this doctor for this and that over there. Yeah. and they all give them medication, and I don't think that there's no chief person looking at all of these different things, and they end up with medications that don't really work well together. They don't play well.
Yeah. And a lot of times I've seen, people will be having a lot of side effects.
Yeah.
They don't maybe realize they're coming from the medicines, but the side effects are often worse than what they're taking the medicine for. So, I've also had people come off of things and they're like, well, this, and this went away just because I came off this medicine. And yeah, you're right about the specialists. I think, you end up going to different specialists, but the body is one machine. And that's what I love about just the whole functional medicine approach is we look at the body as a machine,
right? And
we look at it as something that works together, like no system is separate from the other. So, a lot of times the things that we can do in coaching or that a functional medicine doctor will do is to address those things that are in multiple systems of the body, right?
Yep.
Yeah.
No, absolutely. And I think the other issue, and maybe not quite so much anymore, but I think it's kind of still in there as well, is that the medical profession tends to the run of the mill. Well, I shouldn't say run of the mill. The center, the center kind, not the functional and the integrative so much, but. You go in and you go, well, I'm having this issue, and they'll give you some medication, and I'm like, I can't take that medication. I'll try it or whatever, and I'll have a reaction. Oh, well, people don't have a reaction to that. I said, I had a reaction to that. It's like, well, what was it? I couldn't breathe. Okay. And they're like, oh, okay. Yeah. Then all of a sudden you get their attention. And it's just, it's still, I think that the medical education system is getting better, but it's still not quite there yet. In a lot of places.
Right. And doctors have a short period of time to spend with a patient.
Yes.
So, then that if you're outside of that, say, 15-minute window, it's hard to get to all the things in 15 minutes. If you have a complicated history or complicated medical history. And that is, I think I appreciate all doctors and nurses and all of our providers. And I think they only, they're doing kind of what they've learned, right? They don't maybe even know any differently than what model they're in. And I think it's such a fantastic gift to those who are having an acute problem, right? They're having you have strep throat, or you have a heart attack or a stroke, you're in the best hands when you go to an emergency room to get the care that you're going to need to prevent further damage.
Absolutely.
But when it comes to the chronic disease and the autoimmune realm, I think that's where there's some shortfall, is there's no real root cause support for people that fit into that category.
Mm-hmm.
We as people with, chronic conditions or with autoimmune, kind of feel like nobody can understand or get to what we're, underneath what's happening to our body, right? So, yeah. And I think I've seen a lot of people. I'm connected pretty well in my community, which is outside of Augusta, Georgia. So we have a big medical college here. And I'm seeing more and more physicians who are more interested in learning about functional medicine now, because, they feel like they're kind of, they're seeing 25, 30 people a day, but they've said they don't feel like they're making a difference anymore, so.
It's become like a machine in a way. It's a business as opposed to service. And most people get into medicine because they want to be of service.
Right. I think that, the intention is there to help people, and they're still helping people, but I guess it's maybe sometimes not on the level that they would like to be helping people. And maybe not as fulfilling when you're, seeing you've got this short time with this person, and that they could benefit from so much more care and support than you can offer. And so, that's another way coaching is beautiful too, is it, I have some physicians that also refer patients to me that they don't have the time to really do the lifestyle stuff with, which it does, it happens. They may see that need there, that this person needs to lose weight, or, have some type of like, let's look at your lifestyle, but they don't really have the time to do that for them or with them.
Yeah. Oh no, absolutely. Absolutely. And I think that's a lot of doctors, the ones that are particularly in private practice, in their own, they're not part of, like some large medical group.
Right. Yeah.
And I think that they're the ones that are in private practice or in small groups, right? That they're much more open and much more willing to bring in other people for the patient to be better supported in, all around. I belong to Kaiser. And there's a lot of really good things that Kaiser does. They try and do a lot of support around that kind of thing. But it's still a really, really large organization. There's pros and cons. It's, I'm still there. I'm not complaining, but there are certain times when I'm kind of like, oh God,
you can see some of the downfalls, like some of the negative parts of that.
Yeah, exactly. It's like, how come they don't have their flu shot ready yet? It's, the drugstores are already giving them. How come I can't get one from them yet? It's, it's just a large organization, and it doesn't move real quickly.
Right. That's right. Yeah, so, that does happen.
Yeah. And there's pros and cons that go along with that.
Oh yeah, there are. I agree. Another thing is too, I've seen in my area, but I've also just heard this too in just different parts of the states, is a lot of primary care physicians, kind of their burnout on what they're doing again. And so there's a new, well, it's not really all that new, but it's maybe gained some traction lately, is the direct primary care model, where, you pay essentially a membership fee. You're not using your insurance for this. You're paying a monthly membership fee to have access to your physician anytime you need, like email, support. Your visits are, they can do a lot of telehealth, but they're getting away from that insurance model so they can have a little bit more freedom and time to spend with their patients, because they're not having to see back-to-back patients all day long.
That's nice. That would be very very interesting.
Mm-hmm.
Huh. Yeah, yeah, there around here, at least in the Bay Area, it's I see fewer and fewer physicians that are accessible.
Mm-hmm.
That aren't part of somehow or another. I mean, if they're not at Kaiser, then they're part of Blue Cross, or they're part of the other ones, and then they have the same kind of issues. So yeah, it is so interesting to watch the whole medical model and how it keeps morphing.
Mm-hmm. Yeah.
And
I think people want a provider, and they want people in their medical care team that have the time for them and who want to maybe do research on behalf of them if they have a complex case. And so, yeah, you have to kind of get outside of that traditional model to get that.
Yes.
And yeah, I think a lot of people, because our chronic disease in 2020, so let's see, 60%, so 6 out of 10 people have a chronic health condition.
Wow.
And 40%, so 4 out of 10 have more than one chronic medical condition. And so it's there's a lot of people who are dealing with health issues. And again, not everybody wants to change. Some people do just want to take the medicine and kind of hum along in life and maybe just maintain the way they feel. Or, there are plenty of people too who have high blood pressure who want to keep eating the way they're eating and take their medicine. There are people like that, a lot of them, but there are people who want something different. They don't want to have this damage happening inside their body prematurely, or they want to do what they can do to support their body to be well. They want to do things and enjoy their life and have the energy to do it. So
absolutely, and they want to, and they want to be around for their families, and they don't want to be a burden to their families. Right. Yeah, there are things outside of our control, right? But there are so many things that we can do. And we should be utilizing, if that's what we want for ourselves, utilizing these key lifestyle areas to make some changes and see what happens. Just have hope and kind of have the desire to have, this is the way somebody wants to feel. This is, kind of a foundational place to start is the lifestyle. And then that honestly, I see lifestyle makes a big difference for many people. Like I said, I have, I do these symptom questionnaires, and 100% of people I've worked with over the, almost 5 years have had some type of symptom improvement. Some people have major symptom improvement. And so, but it didn't come easy, they had to maybe sacrifice and give up some things that they've enjoyed. But we also look at that perspective as, well, there's so many other things and so many wonderful benefits of this too. Like I might be missing out on, pizza or, whatever, but I can also look at this list over here of how much better I feel and how much better I'm sleeping and how much less joint pain I have. So there's a lot of that there too. Oh yeah, no, and that I know myself, that's what always keeps me away from eating the things that I shouldn't eat. And
And I consider it, when you're having, your body's giving you this sign,
Thank
it's a
you.
blessing,
Yeah.
honestly. This is what's happening when I do this. So when we have that, it might not be comfortable, but we can address that if we desire.
Yeah. Yeah. Oh no, absolutely. Absolutely. And probably the worst thing that has happened is that there are all of these other, I want to say pills, but they're not pharmaceuticals, things that you can get at the health food store and stuff like that,
Mm-hmm.
so that you can have gluten and you can eat dairy
Yes. Mm-hmm.
and you don't have the
Mm-hmm.
typical reactions, but it doesn't mean that the dairy and the gluten is good for you.
Right. It would be used if you had an accidental exposure, more or less not dependent, and I know,
Uh-huh.
some people might depend on those to
Yeah.
think, oh, I'm actually protecting myself. But yeah,
Yeah.
that's hard.
That's how they sell them.
I know. Yeah, absolutely.
Yeah. Yeah. So I have a couple of them in my cupboard, and every once in a while I cheat
Mm-hmm.
and have a piece of real pizza, but I don't do it very often, and I always take my little pills with me
Yeah. Yeah.
to help.
Yeah. Oh.
But yes. Okay. Well, is there anything you'd like to just kind of say to kind of wrap up and you know, the message that you really would like to get out to people? And I will also put,
Yeah.
your information, and if anyone wants to contact you, I'll
Sure.
put that
Yeah.
in the
They
show
can find
notes,
me.
and then
Mm-hmm.
people can get a hold of you and say, oh, I saw you on the podcast.
Yes. Well, I guess to wrap up, I would say that I believe that if you desire to feel better and you desire something different for your life, I believe there are ways that you can go about getting that result. And it might not be the easiest thing, right? It might not be, but I think it's going to be worth it. And if you want to, not just manage your disease or manage your symptoms, if you really want to get underneath and find out what's going on in my body and how can I support my body, our bodies are designed to be here and thrive, and we have a wonderful immune system that is ready to protect us and take care of us, and if it's going haywire, then there's a reason, and we need to
Uh-huh.
consider that. And if somebody wants to look at those things, then yeah, I would be happy to support them and help them. If they need further testing, they need to get connected to a physician, I can help with that as well. And so yeah, a lot of people have these daily symptoms and they're dealing with this pain every day. And so I have created a coaching program to help people to, deal with the poor lifestyle choices or the things that aren't supporting them, and to work on getting a healthy gut so that they can feel better and they can have less symptoms and they can have less pain every day and have more wonderful days. And then, sometimes you see things resolve completely, and I think that's also something to think about. So, yeah.
Well, that sounds good.
Yeah,
That
thank
sounds
you.
very good. Yep. And thank you so much for coming on and
Yes, thank you
spending the
for having
time
me.
with
I
us.
appreciate it. Yeah, it's great to talk with you
Yeah.
and just talk about the subject.
Okay. Well, let me do my usual at the end, which is that I am not a doctor, and this is not medical advice, and neither of us are giving medical advice. If you are having any kind of medical issues, please go see your doctor. If it's an emergency, please go to the emergency room. And that, I think, is going to be the end of this podcast. So I will be talking with all of you next week.